14, we are continuing in the nervous system, but we're looking particularly at the spinal cord and the spinal nerves, as well as reflexes. And we've talked a little bit before, I'm all in y'all's way, about the spinal cord and transmitting signals. So you kind of have an idea of how important the spinal cord is in relaying information from the body to the brain, for example, and then from the brain to effectors. So in that respect, you could say that the function of the spinal cord is conduction, and I refer to it as an information highway, which passes information between the PNS and the brain. And so, for example, if you think of an interstate such as I-65 connects Alabama, Tennessee, Kentucky, on up. And so that allows people, vehicles, to get from one state to another. And I like to think of it that way because, again, information is traveling up the spinal cord. What type of information would you say travels up the spinal cord? Travels north. Sensory information. And what type of information travels south? Motor. Okay? So, and what happens if there is a traffic jam or an accident? Exactly. So if there is an accident, there is no cars getting past that point. And we kind of talked about what happens in that situation in the spinal cord. So if there's damage to the spinal cord, which occurs in a lot of times in vehicle accidents, then the signal can't get past that point, and therefore we can't sense pain, touch, and we also are not able to move voluntarily. Okay? So in the spinal cord you have bundles of fibers passing up and down, and also another important function of the spinal cord is, we'll talk about reflexes, which are involuntary stereotype responses to stimuli. We'll talk more about that at the end of the chapter. But the key word there is involuntary. So our reflexes don't necessarily require our brain. An example of that, if you think of a type of reflex, when you're tapped on your patellar tendon under your knee, your leg jumps up. And so what's happening is a sensory signal goes from your knee into your spinal cord, but then comes right back out of your spinal cord to muscles to cause your leg to kick up. Signals also go to the brain, but the reflex loop does not involve that part, the brain, that is. Okay, so the anatomy of the spinal cord. First of all, the spinal cord is a cylinder of nervous tissue that arises from the brain stem. So we'll see that we have the brain and then the brain stem, which is connected to the spinal cord, which goes through the foramen magnum. Remember that? The foramen magnum at the base of the skull, and then it travels on down through the vertebral canal. And the spinal cord itself is about as thick as your finger, and it occupies the upper 2/3 of the vertebral canal. I'm going to open the door because it's just too warm. If I have to shout out, just shout. Okay, and then the inferior margin of the spinal cord ends at L1, or a little beyond. So that's just one of the anatomical features of the spinal cord. Again, it only occupies the upper 2/3 of the vertebral canal. And if you can see a picture here, you can see the spinal cord actually ends at which vertebrae? About L1. So below L1 there is no more spinal cord. Instead you have what? Nerve roots. But the spinal cord ends at about L1, between L1 and L2. Okay, then there's the spinal cord enlargements, additional features that you'll see, that there's not a uniform thickness of the spinal cord. There are two places where the spinal cord gets thick, and then it tapers, then it gets thick again, and then tapers to a point, and the lower end is called the conus medullaris. It's kind of cone shaped. But notice the areas where it's thick. You have the cervical enlargement and also the lumbar enlargement. And I also always ask the question, why would those two parts of the spinal cord, you think, be thicker than the other parts of the spinal cord? Cervical. So more signals must be going in, right? So if you think of the spinal cord, it's nervous tissue, right? Nerves coming in and out. So there must be more signals coming in, traffic jam reference. So if you have more cars getting on the interstate, at that point, it's going to be more congested. It's kind of what's happening. So what is the cars? What are the cars we're talking about? Right, signals. Signals coming from neurons from the upper limbs. Okay? So if you just think about for a moment, we have receptors on every piece of our skin, right? Fingers, fingertips, finger, hand, wrist, all of our arm, all of those receptors are connected to what? Neurons, and they're all sending signals into the same level of the spinal cord, and that's at the cervical enlargement region. Compare that to the parts of the body that have to get the signal to the thoracic spinal cord. What parts of our body are sending signals into the thoracic spinal cord? Right, just our waist, right? So the skin of the waist, the fatty tissue, the muscles. And so you can imagine then that there's more cars traveling into the cervical region than there would be into the thoracic region. And then on the flip side, you still have those signals going out of the cervical region to the muscles of the upper limb. Okay, so what about the lumbar enlargement? What's responsible for that? The lumbar enlargement. Right, the lower limbs. Good. Okay, so the cervical enlargement is due to the nerves of the shoulders and upper limbs. Lumbar enlargement is due to the nerves of the pelvis and the lower limbs. Okay, the segment. So part of the spinal cord is supplied by each pair of spinal nerves is called a segment. So know that there are 4 different regions of the spinal cord. You have the cervical, thoracic, lumbar, and sacral regions of the spinal cord. And you should also remember for the test that there are how many spinal nerves? 31 pair. So 62 total. Right, so 31 pair. The first pair passes between the skull and the first vertebrae. You all remember the name of the first vertebrae? So you have C1, but the name of it is the atlas. Very good. And number 2? Axis. Good. Okay, and you can look at this picture also to memorize how many nerves there are in each region. So in the cervical region, there are how many nerves? We have C1 to C8, right? So you should know how many there are in each region. In the thoracic region, there are how many spinal nerves? 12. And they're named T1 to T12. Then you have L1 to L5. And then S1 to S5. And then you have that one coccygeal nerve. Okay, and then the conus medullaris again is the conical spinal cord segment below the enlargement. So that's the tip of the spinal cord at the inferior end, and it's cone shaped, so that's where the name comes from. And then the cauda equina are the nerve roots that extend below, and it kind of looks like a horse's tail, and that's where the name comes from, cauda equina. The meninges, we have spinal meninges and also cranial meninges, which are continuous. So the meninges are membranes that cover and protect the nervous tissue of the spinal cord and the brain. So be familiar with the meninges, what their function is, and also their location. There are 3 layers, 3 membranes, and you should know them from superficial to deep. Okay, so the outermost meningeal layer is the dura. So the dura mater is closest to the bone, right? So if we're talking about the brain, covering the brain, we're talking about the skull, and if we're in the spinal cord where we are, we're talking about the vertebrae. So just imagine if you have to stick a needle all the way to the center of the spinal cord, which you would never have to do. But if you did, just think of all the tissues you'd have to go through. So first you'd have to go through the vertebrae, right? And then deep to the vertebrae, you have fatty tissue, but then you get to the meninges. So what is the first of the meningeal layers? The dura mater, and then deep to that you have arachnoid. Arachnoid. Everybody say it. Arachnoid. Yeah, practice saying these words so it kind of gets in your brain. Arachnoid. Okay, so that's the dura, arachnoid mater, and then you have pia mater, which adheres to the spinal cord or the brain tissue. Okay, so those are the 3 layers in order: dura, arachnoid, and pia mater. And then you get to the spinal cord. So the spinal cord has 2 different colors. The outer part of the spinal cord is white, made up of white matter. And then deep to the white matter you have gray matter. Okay? So dura, arachnoid, and pia mater are the layers of the meninges, and then you have the spinal cord, which has the outer white matter and the inner gray matter. And we'll get to those in a moment. The dura is going to, again, be continuous in the spinal cord and covering the brain. Fuses with the periosteum of the occipital bone. Tapers to dense cord of collagen fibers, forming a coccygeal ligament. And then there's the epidural space. And again, you all should be familiar with the terminology. Epidural, so you should know what that word means by itself. Epi, what is the prefix epi? What does that mean? Epi means... Have you all had medical terminology? If not, you should take it. Good. So epi, that's one of those you'll see all the time, and from now on you should be able to figure out what a word means by using those word parts such as epi. Epidermis. Think about epidermis. Y'all heard of it? Epicondyle. So epi means above or upon. Okay, so the epidermis is on top of the dermis. Okay, so the epidural space would be the space where? Above the dura. Okay, so above the dura, it's easy to think about if you're referring to the dura mater covering the brain, because above the brain would be the space, or above the dura would be the space between the dura and the skull. But where would the epidural space be if we're talking about the spinal column? Would it be in between the bone and the dura? Yes. Okay. So the epidural space then would be here, right where the fatty tissue is. Okay, so the space between the vertebrae and the dura mater would be referred to as epidural space. Okay, what about subdural space? Where would that be? Under what? So it would be below the dura or between the dura and arachnoid mater. Okay, so you'll see those terms on the test. Be looking for them: epidural, subdural, and also subarachnoid. So where would the subarachnoid space be? Good. Okay, so subarachnoid would mean, the word means what? Under or below the what? Arachnoid mater. Okay, so it will be found between the arachnoid mater and the pia mater. Okay, so just a little terminology there, and all that's on the slides here. Okay, and also we'll talk more about the meninges after the test for chapter 14, but we'll also talk more about CSF. Just have an idea what CSF is. It's fluid found around the brain and spinal cord and also inside the brain and spinal cord. It carries dissolved gases, nutrients, and wastes. And you've heard of lumbar puncture or spinal tap, where CSF was withdrawn for inspection in case someone has some type of infection, encephalitis or meningitis, which we'll talk about again in a couple weeks. Okay. Moving on. So white matter and gray matter. White matter. So what do we say about the distribution of white matter and gray matter in the spinal cord? White matter is where? Superficial to gray matter. So gray matter is deeper within the spinal cord, and white matter is superficial. Pretty much. Okay, it surrounds. That's probably better. Also, what you should think about is what it is that makes white matter white. Because there are some things we're going to talk about where you have to have an idea, well, what do we find in white matter and what do we find in gray matter? So for the most part, white matter is white because of myelin. Okay? So if I ask you what part of the neuron predominates in white matter, you would say what? Axons, right. So in your white matter is where you have those fiber tracts of fibers that are covered in myelin. In gray matter, it says here that gray matter contains neuron cell bodies, neuroglia, as well as unmyelinated axons. But you can just highlight cell bodies. Okay, so cell bodies, which I call the brain of the neuron, the cell bodies are going to predominate in gray matter. Okay? And what did we say a bundle of cell bodies is called? Remember that? Ganglia. Okay, so bundles of cell bodies are called ganglia in the PNS. But inside the spinal cord, bundles of cell bodies are called nuclei. Very good. Okay? So nuclei you'll hear a whole lot about, especially in the next chapter. So keep that in mind. Bundles of cell bodies in the PNS are called ganglia. In the CNS they're called nuclei. Okay. Now, and this is somewhat challenging, but not really, but this is one of the biggest parts that you'll see on the test for chapter 13. Organization of gray matter. So what I want you all to do is start to be able to visualize this picture and the gray matter. So what do we say is found in gray matter? Cell bodies. Okay? So what you should do for the test is know what you will find in the different parts of the gray matter. And the two parts I'm going to ask you to know about are the dorsal horn and the ventral horn. The dorsal horn and ventral horn. What is it that you find in those two parts of the spinal cord? Dorsal horn and ventral horn. And notice up here it's labeled posterior and anterior. I think, what does your book call it? Dorsal or posterior? Really? Posterior? Okay. So the posterior horn on the test, it'll probably be dorsal.
It does it for the sensory, it does posterior or dorsal. And for motor, it does anterior or ventral.
So yeah, so just as long as you all know, and I know Ms. Smith taught you all the directional terms, posterior is the same as dorsal. Okay? Anterior is the same as ventral. Okay, so in the dorsal horn, you're going to find sensory, cell bodies of sensory neurons. Cell bodies of sensory neurons in the posterior or dorsal horn. And really think about that. It's all written up here. It's all on the slides. The dorsal horn contains cell bodies of sensory neurons. What I want you all to do is make sense of it today. You can write it down, I don't mind, but try to, as much as possible, to think about it. The ventral horn contains what? Cell bodies of motor neurons. So what I think is a good idea is to get a visual picture of the spinal cord, of these parts, and just in your mind tell you the dorsal half of the gray matter contains cell bodies of sensory neurons, and the ventral horn has cell bodies of motor neurons. Okay? Another way I'll say that is the dorsal horn contains sensory somas. Right? Isn't that the same thing? Sensory somas. Somas are cell bodies. And the ventral horn contains motor somas. Okay? So what you should start doing is aligning the dorsal half of the spinal cord with sensory function, the ventral half with motor function. Okay? So right now we're just in the spinal cord, but we're about to go out to those nerves. So where are the nerves? They're here, right? These are the nerves. Notice the spinal nerve is not directly connected to the spinal cord. You see that? This is the spinal nerve. These are what? Nerve roots. Okay? So the spinal cord connects to nerves through the nerve roots. Okay? And so we have a dorsal root and a ventral root. If I asked you the function of the dorsal root, would you say sensory or motor?
Sensory.
Sensory, good. So y'all are catching on. The ventral root has motor function. Okay? So what do you find in the dorsal root? That's going to be sensory axons. Sensory axons are found in the dorsal posterior root. And again, that's also on here. So the dorsal root contains sensory axons. The ventral root contains motor axons. Okay? Well, tracts are bundles. And also they're in the spinal cord. Okay? So we're not in the spinal cord anymore. So we're in the nerve roots. Okay? Yeah. So remember, CNS is just confined to the what? Brain and spinal cord. So we're outside of the spinal cord now. And the roots. And so basically you should know, if I ask you on the test, what do you find if you cut open the ventral root?
Axon.
Motor axons. Axons of motor neurons. You should also know, if I ask you about the ventral root, which direction the signal is going. Is it going toward the spinal cord or away from the spinal cord? How do you know? All right, okay. Because it's motor, that's correct. The motor signals go away from the CNS. Okay? So you have to put all that together. All right. So then you have, so notice the ventral root merges with the dorsal root to form the spinal nerve. So our spinal nerves are what? Mixed in function. Okay? So if they merge, you have the sensory axons merging with the motor. So inside the nerve, you have both sensory neurons and motor neurons. So spinal nerves are mixed in function, carrying both sensory and motor signals. All right, one more time. So the posterior root ganglion. So first of all, what did we say a ganglion is? So we have the dorsal root ganglion. And the dorsal root ganglion, we know since it's a ganglion, it contains what? Somas, right? Cell bodies, bundles of cell bodies. So if you cut open the dorsal root ganglion, you're going to find a bunch of cell bodies. Now, are these cell bodies sensory or motor? Sensory because it's in the dorsal. Good. Okay? So that's before you get to the nerve. You see that? Okay.
So the anterior one and the posterior.
But notice that the ventral root does not have a ganglion. No such thing as a ventral root ganglion. Only the dorsal root ganglion. Okay? So that's just hopefully it's not too difficult for you all to remember. It's 5 places where you need to know what's located in those areas. The dorsal horn, what's there? The dorsal horn, what's found there? Dorsal horn. Sensory somas. Instead of looking at your paper, look up here. Look at the picture. No, I'm just saying you all can look at your paper all night tonight. Try to figure it out by getting a picture of it in your brain so you can remember it. So looking up there, where's the dorsal horn? Can you see it? Picture it. It's the posterior horn, so it's the gray matter on the top of the picture. So what do you find in that part of the picture? Sensory cell bodies. So we know it's cell bodies because it's gray, right? And we know it's sensory because it's dorsal. Okay? So what do we find in the ventral horn? Motor cell bodies, right? So we know it's cell bodies because it's gray, and we know it's motor because it's ventral. Now go out to the dorsal root. So we know in the dorsal root, the function is going to be what? Sensory. But now what part of the neurons are collected there? Axons. Okay, so you have sensory axons in the dorsal root. What about the ventral root? Motor axons. Okay, the bottom half is motor. And now the posterior root ganglion. Again, ganglia contain cell bodies. And since it's dorsal, it's sensory. Okay? So instead of trying to just memorize the words, try to picture it and remember it that way. Now, what I want to also go to, hopefully this will help you put all that together.
So the roots are from
No, they're outside of the spinal cord. Gray matter and white matter is in the spinal cord. All right, see if,
The posterior and ventral horns are inside of the spinal cord,
The horns? Yes. Yeah, inside the spinal cord. So when you look at the picture, all the white matter and gray matter are a spinal cord. So you can see it up here. It's just a different color. So you see the spinal cord there, and the gray is actually gray in this picture. Right? So see if you can see what we're talking about. So follow from step number 1. So step number 1 would be activating a what? A receptor. So that activates that neuron to send a signal from the finger all the way to the what? All the way to the spinal cord. But look at the neuron. Follow the neuron's path. So the first part of the neuron that's in the finger is what part of the neuron, would you say? So that's the receptor. And then what part of the neuron is this, though? So the neuron has 3 parts, right? So that first part is probably the what? What part of a neuron? Hmm? 3 parts. Name the 3 parts of a neuron. 3 parts of a neuron. A neuron has 3 parts. Dendrite, cell body, axon. Okay? So the signals usually come into a neuron through the dendrite. Okay, so that's the dendrite. Now follow that dendrite all the way until the next part. Look at the picture. So that dendrite, the dendrite ends where the what begins? The soma. Right, look at the picture. Look at the neuron. So on that first neuron, tell me where its cell body is located. Cell body of that first neuron. Cell body. Can y'all just not see the picture? It's blurry, okay. So the cell body is the little ball, right? The little beady looking part. Y'all with me? So a neuron has 3 parts. Dendrite, cell body, axon. So that first stimulation activates the neuron, but it's going to first activate the dendrite, which passes a signal to the next part, which is the cell body. Where is that cell body located? Yes, but what part of what we just talked about is this located? The dorsal. Look at the picture. That cell body is where? The dorsal root ganglion. Okay, so what did y'all tell me is found in the dorsal root ganglion? Sensory cell body. All right? Is it coming together? All right, it takes a minute. All right, so now that axon, from the cell body, the signal goes through the rest of the neuron, which is what? The axon. And where's the axon found? Look at the picture. What part of? Yeah. The dorsal root, right? Y'all with me? Don't look at anything but the neuron. So the neuron has the dendrite, the cell body, and the axon. Okay? This is one sensory neuron, right? So a sensory neuron takes the signal from the receptor to the CNS, that one neuron. Okay? So if I ask you where is that neuron cell body, that neuron cell body is where? In the dorsal root ganglion. Where is that sensory neuron's axon? In the dorsal root. Okay, which connects to the spinal cord. All right? Okay, and then once that axon gets in the spinal cord, it forms a synapse with a second neuron. And that second neuron cell body is where? In the dorsal horn. Okay? So the dorsal horn. Okay? Y'all still look confused.
Okay.
I don't understand the confusion.
I think I'm overthinking it. Because I'm thinking about the second neuron already when you're saying think about the second part, but I'm not supposed to be thinking about that. I'm supposed to be thinking about
transfer the message.
Yeah.
it takes 3 neurons to transfer message.
Right. So when you're touched on your finger, before you can feel it, the signal has to get where?
To the CNN.
To your brain. Okay? It takes 3 neurons
To get
it to your brain.
Okay.
Okay? The first neuron is at your finger, but it stops in the spinal cord. A second neuron starts in your spinal cord right there, and then takes the signal up to the brain. And then there's a third neuron that takes it from the thalamus in the brain to the cerebral cortex, the parietal lobe. Okay? You don't have to know that right now. Yeah. Y'all don't have to know it that deep. All I want you all to know is this part here. If it looks like y'all, it's throwing you off. But I did want you all to visualize the parts I just told you all to know. Basically, the sensory neuron cell body is found in the dorsal root ganglion. The axon is found in the dorsal root. And then the second neuron
So we start
cell body.
Cell body, right?
Right, not dendrite. You don't see this dendrite here. The dendrite is there, but I'm not asking you to know where that dendrite is. I'm not asking you to know where any dendrites are. Right? All I ask you to know is where the cell bodies are and the axons.
So it
Okay.
goes from one cell body to another cell body. But it's going to be, on the second cell body, it's going to be in the ventral
Dorsal horn.
dorsal horn.
Yes.
Okay.
Okay? Now, questions? Mhm. There is no ventral root ganglion.
It's only a dorsal.
There is no ventral root ganglion, only a dorsal root ganglion.
Oh, okay. I was just thinking about it because I was trying to listen to when you had on one of your studies.
Okay, so it's probably to trick you. So you'll say there is no ventral root ganglion. That's the answer to it. Mm-hmm. In the dorsal horn? Yes. Correct.
That's the second neuron.
Mm-hmm. So the second neuron is called first order and second order neuron. And that's going to take it to the brain. And this picture is not showing you that because this is showing you a reflex. But I do have another picture. And I don't want to throw y'all off, so I won't show it right now. But that one takes the signal on up. Okay? Right here, all I wanted you all to know is those 5 parts. Dorsal horn, ventral horn. Dorsal root, ventral root, and dorsal root ganglion, and what's located in those. If you all are fine with just memorizing that, that's okay. But if you want to see it, that's what I put this up here for. So the ventral horn, what do you find there? Cell bodies of
The second neuron.
motor neurons. Okay? So motor neuron cell bodies are located in what part of the spinal cord? That's a test question. Probably verbatim.
In the ventral horn.
Okay? Cell bodies of motor neurons are found in what part of the spinal cord? The ventral horn. Okay? So from the ventral horn, the signal is going out to a what? An effector. Good. Okay? And so from the cell body, the axon is responsible for transmitting that signal. So the axon goes through the ventral root, okay, before the nerve and then the muscle.
So each one of those little round things is a cell body.
It's a cell body, yes. The little round things are. And next time we'll talk about reflexes, and that's what this is. Remember, reflexes do not involve the brain. This is where the signal comes into the spinal cord and right back out of the spinal cord. Question? Integrity, there you go. All right. A few more things here, and then y'all can start on your lab. Okay, this is the one I was going to show you. You all don't need to know this. I think I took it out of your slides, but this is showing you this, how the signal goes up to the brain. This is the first neuron. It's also actually called first order neuron. Send the signal to the second neuron. You can see the cell body is where? In the dorsal horn. And then that second neuron takes the signal all the way up to the brain, part called the thalamus. And then a third neuron takes the signal on to the cerebral cortex, the main part of the brain. Okay. All right. So tracts, again, know what those are. Bundles of axons where? In the CNS. And some tracts are ascending, some are descending. And you should be able to tell me which ones are sensory, ascending or descending. So ascending tracts carry sensory information because it's going up to the brain, right? Descending tracts carry motor signals down the spinal cord. And be familiar with the terminology paraplegia, quadriplegia, and hemiplegia. So paraplegia would mean what? Paralysis of just the lower limbs. How can you have paralysis of just the lower limbs? What? Okay, so what does it take? And that's the question. What does it take for someone just to be paraplegic versus quadriplegic? The damage must be where? Does it have to be lumbar? Or can it just be below?
Just your leg.
Below the cervical region.
Good. That's it. So that's it. If you look at the spinal cord, a picture of it, I didn't mean to go back this far. So as long as the damage, so what we were saying, so the enlargement, remember those are transmitting signals to and from the upper limbs. So if the damage is below the enlargement, like in the thoracic region, as long as it's below cervical, then you'll be able to have sensation and movement of your upper limbs. Okay? So when does it become quadriplegic? Right, so in the cervical region. So if the damage is in the cervical region, then that's going to affect the upper and lower limbs. What about hemiplegia? What does that mean anyway? That means one side, right? When do you see that? How can that happen? Okay, good. So hemiplegia is paralysis of one side of the body, and we'll talk more about that when we talk about the brain, because one side of the brain controls the other half of the body. So if one part of the brain is damaged by a stroke, for example, then you'll lose the use. Well, also, if you have damage to one side of the spinal cord, which happens sometimes if there's just damage to that one side, but it's usually going to be due to a stroke. Yeah. Okay, and then dermatomes are regions of skin supplied by a single spinal nerve. Simple stuff. So all these letters. So if you take C3, for example, You see the part, the back of his neck has a C3 on it. All that means is that that part of his skin, he feels sensation by the C3 neuron, or the C3 nerve, transmitting sensory signals into the spinal cord. So, in other words, if his C3 nerve was cut or damaged, then what would be the result? He wouldn't have any sensation in that part. Okay, you could touch him, cut him in that part, and he wouldn't feel it. But also keep in mind that there's a 50% overlap. So, in order for him to lose all sensation in that part, he would have to lose function of C2 and C4 also. So they kind of overlap to some degree to take up the slack if something is wrong with one of the nerves. So not a whole lot there. Shingles, you all know what shingles are. Chicken pox in old folks. So when we're young, if we have chicken pox as children, the virus, so the virus stays in our body in the dorsal root ganglion. Okay, so if you've ever had the chicken pox, you still have the varicella zoster virus in your body, but the immune system keeps it in check. But as we get older, our immune system isn't as strong, and it tends to come back out commonly after the age of 50. Or if you have some other issues with your immune system, it may pop up. Question, I saw a hand.
Why, like, people like who have autoimmune diseases, are they more at risk, like, okay, I assume they're more at risk for shingles, but could shingles kill them?
Shingles doesn't usually kill, no. No.
Very, very bad.
Right. But what happens is, if a person has shingles, it's usually because their immune system is not functioning up to par. So something else could kill them. If they can get shingles, it means they can get other germs as well. Okay. All right, we'll stop there and pick up on Tuesday. So I guess the test will be Thursday.